study in a tertiary center, 872 acute PE patients from different risk categories were treated with thrombolytic, anticoagulant alone, and catheter-based therapies in accordance with currently available acute PE guidelines. The population was retrospectively analyzed and divided into two groups according to the presence of active malignancy. Active malignancy was defined in patients with symptoms and signs of malignancy, with imaging modalities and or who received treatment for malignancy in the past 6 months. And active malignancy was documented in about 15% of patients. Gastrointestinal tract and lung malignancies were more common malignancies in this group. And in the groups with or without malignancy, the low, intermediate, high, and high risk patients were in percents as you see. Intermediate, high, and high risk PE patients were more common in the malignancy group, while two groups did not differ in terms of echo and computed tomographic pulmonary angiography measures. Contraindications for thrombolytic were more frequent in the malignancy group. Ultrasound-assisted thrombolysis, rheolytic thrombectomy, systemic thrombolysis, and anticoagulant alone therapies were noted in 27.3%, 6.4%, 6.4%, and 49.9% of all patients. The rheolytic thrombectomy and anticoagulation alone therapies were more frequent in patients with malignancy. And lytic dosages and treatment durations in USAT and systemic thrombolysis protocols were more comparable between malignancy and non-malignancy patients. Regardless of the presence of malignancy and the treatment modality chosen, significant improvements were achieved in the clinical echo and CTPA parameters, measures of the PE severity. Minor and minor bleeding rates were comparable, while in hospital and long-term mortality were higher in malignancy group. Active malignancy and PESI score were independent predictors for composite endpoint of 6-day mortality and P-related rehospitalization. Malignancy and chronic obstructive pulmonary disease were independent predictors of long-term mortality. Concomitant malignancy adversely affects both short and long-term outcomes in patients with acute PE. Although these patients are more vulnerable, it is possible to achieve satisfactory treatment success with acceptable bleeding rates with the inclusion of catheter-based therapies. Thank you very much for your attention.
Thank you. Any questions from the audience?